Well, I have a question, Mr. Joe.
Yeah.
If I have a patient that has been resolving, but we didn't initially shoot the X-rays for the flexion extension views, but now we shot them, and it does show that he most likely does have either AOMSI or AIMSI. Would I do that if he's improving? I mean, he's almost at 1 out of 10 pain levels. Would I still do send out the AOMSI for the reading?
Yeah, there's really two different questions you just asked in there. So the first one is, and I get this a lot, what do you do with a patient that you're presently treating or you've already treated and now you're learning, what documentation should have done you didn't do? And the answer to that is go back and do it. That's the answer. And then what you do is you add an addendum. Add an addendum, an updated addendum. That's what you do. Okay? So whatever patient you have in the mill, so to speak, and you didn't do this or that, then if the case is not settled, get with that attorney and get that patient in there to update your findings and include an addendum. That's what you want to do. And all the tests, all of them, not just AOMSI, whatever you didn't do. So the second part of that is whether or not you would do the AOMSI test if the patient's getting better or close to better. Let's say they're 1 out of 10. And the answer to that is yes. And the reason is it important to know if this person is going to have a permanent injury? Yes, it is. And also from a legal standpoint, a paid standpoint, medical legal, it's going to be very important. But you definitely want to do it if you have not done it. And the reason is it's not just for the present situation, okay? Wouldn't you want to know of a problem that there's no signs or symptoms, but you know darn well it's going to cause you big problems down the road? Yes, you would. And that's what this is. So you have a mechanism of injury. You have a mechanism of injury. You have the signs and symptoms. So do the test. Even though the test, let's say the tests are even normal now. I'm still going to do the test because we had the history. We had the history of it. So if you have the history, if you have the reason for doing it, but you didn't initially do it, and just do it, and then you have the history, you have the test, and now even if the patient is 0 scale out of 1 to 10, they still have a permanent impairment if that's what that documentation shows. Well, that's going to be a lot of problems down the road for this person, even though they don't have any symptoms now. And then a simple example to that would be, let's say somebody comes in and they have cancer, and they got a lot of pain and this and that, and then they go through treatment, and they're feeling pretty good. Don't have any more pain, they're feeling good, and they release them. But the person, if let's say you were to still do a blood test, they'd still have remnants of the cancer or cancer indicators. Would you not have done that blood test? Would that whole scenario not be relevant to the future? No, that test would be relevant, and the whole scenario would be totally relevant to what's going to happen in the future. It's the same way with this injury. This injury, altered biomechanics that heal wrong, causes problems. Usually you may not have any symptoms now, but you can be guaranteed that altered orthokinematics, or especially if it's LMSI, that's going to cause serious problems 5, 7, 10 years down the road. That's going to cause significant restrictions and limitations in pain.